became impossible to ignore during the pandemic when communities of color suffered a disproportionately high mortality rate. Now there's growing hope for change and a future where everyone, regardless of their race or zip code, can have an equal chance at a healthy life. In late 2020, the prestigious American Medical Association, or AMA, declared racism a public health threat, saying the AMA recognizes that racism negatively impacts and exacerbates health inequities among historically marginalized communities. It was the type of official acknowledgement that opened the door for changes frontline healthcare providers like Dr. Torian Easterling have been fighting for their entire careers.
We're really clear that there are systems and structures that are set up that assigns value, and those values are different for certain people, particularly based on the color of your skin. And so what we really want to make sure is that all of the resources in our community are set up that we can achieve the optimal health for all people.
Those disparities can begin with a lack of access to quality health care in early stages when it's most needed, like prenatal care during pregnancy. It also manifests in the treatment of chronic conditions like asthma and diabetes. Assumptions and stereotypes can affect what treatments are offered and the level of care, says New York State Assemblymember Carinas Reyes, who's a registered nurse.
It means that there are people in place and systems in place that don't value us because of what we look like and where we come from. And that has an ultimate effect in how we receive care and our outcomes, our health outcomes.
As with many aspects of life, money plays a big role too. The quality of care can often depend on a patient's health insurance and location. Access to accurate health information is also key to positive change, says Dr. Easterling.
We certainly learned that the words that we use, our messaging, we have to be clear. We have to make sure that it is tailored in a way that is culturally responsive and conducive for the communities that we're serving. We are seeing how misinformation has really spread throughout our community. We got to get there fast, and we have to be clear and concise.
Managing your own health has been the motto of hip-hop superstar and entrepreneur Styles P. A founding member of the Locks, he's one of the first health advocates in hip-hop and opened up his chain of juice bars called Juices for Life in underserved communities. He says take control of what you can.
Just pick one day out the week. I would say with everybody baby steps. Pick one day out the week where you know you're going to eat clean. You're not going to eat anything fried. You drink your lemon water. You exercise, whether that's even just taking a light little walk.
Let's find out more from our panel. Joining me is Dr. Torian Easterling. He's the Chief Equity Officer of the New York City Health Department. He's also the first Deputy Commissioner. Dr. Easterling, thank you so much for being with us.
Thank you for having me.
We appreciate it. Also with us is Styles P. He, as you know, is a legendary hip-hop artist. He's a member of the group The Locks, and he's also a health advocate. We've had him on the show a number of times talking about hip-hop and health and staying healthy even while you're on the go and in a very active entertainment industry type of lifestyle. And he is also the owner of Juices for Life. Styles, great to have you with us.
What's up, sis? How you feeling?
I'm doing great, thanks. Thanks so much for being with us. We appreciate it.
Always.
Thank you so much. Also joining us is Carinas Reyes. She's a New York State Assembly member from the Bronx. She's also a registered nurse. Carinas, thank you so much for being with us.
Always good to see you, Lisa.
We appreciate it. Dr. Easterling, I want to start with you on this. In terms of when we talk about health disparities, what are we really talking about here?
Yeah, we're talking about intersecting system structures that are set up, and we see differences in health outcomes. We see these differences in educational outcomes. We also see these differences in how people access resources. And so we don't want to just focus on whether or not someone has health insurance, someone is able to access their primary care doc. What we're saying is we want everyone to be able to achieve the healthiest life that they can. In order to do that, we need to make sure that the systems that are set up value the life of everyone. And so in New York City, what we say is that your zip code should not determine your length of life, your health status, but that's the fact, that's the reality here in New York City and many other metropolitan cities. So if you're standing in Brownsville, less than 11 miles, away from Brownsville, someone can have a higher life expectancy than someone who resides in Brownsville, and that shouldn't be.
Definitely. And that's why we wanted to do the show, to highlight this, explain this, help everybody understand this, and also empower ourselves so that we can help our families and our neighbors here. Styles, when did you first really become aware of the health disparities, and just in terms of the food that's available in the communities?
Honestly, when I was fortunate enough to make money and move into a more affluent neighborhood, and just by going to the supermarkets and noticing the stores that were around, it was just such a big difference. It was actually really shocking. And as the commissioner just said, I didn't live too far from where I originally grew up. It wasn't that many miles away. It's maybe 10, 11 miles away, 20 at tops. But the lifestyle and the difference of the produce, even on plant-based, even the meat, the chicken, everything is just a big difference that you see when you live in a wealthy neighborhood as to what you see in a poor community. And as the deputy commissioner said, food should be equal for everyone. That shouldn't be determined on your class or what you make, how much you have, or how powerful you are in life. Everyone should be able to eat the same amount of things, same quality.
Right, definitely. Cardenas, when you were in the hospital too during the height of the pandemic, we spoke with you at that time. How did you see these health disparities, especially for people of color and under-resourced communities, play out?
Yeah, well, one of the predetermining factors in what your outcomes would be with COVID were if you had existing underlying conditions like diabetes, heart disease, all those comorbidities. And the reality is that in communities of color, our prevalence of being diabetic, hypertension, heart disease are so much higher. And it's not just related to personal choice. It's what Dr. Easterling said. It's these intersecting systems. We've talked about environmental justice and how Robert Moses designed highways that divided our communities, and dumped tons and tons of pollution in our neighborhoods every day. And that's why, for example, in the Bronx, we have the highest asthma rates for children and the highest hospitalization rates for asthma exacerbation in children as well. And all those factors contribute to our outcome. And that's why we saw communities of color having some of the highest morbidity and mortality rates related to COVID.
We have much more to come. Stay with us. What was happening? What were some of the things that you noticed in the community?
In the community, I think there was just this kind of blanket of uncertainty. It was mixed information, and the information was changing by the minute. Not just for us personally as healthcare workers, because we saw that as we were working in medical facilities as well. But I think just for the general public, the fact that we didn't have clear, concise information and it was ever changing created this mistrust. People just didn't know what to do. Some people, you would see folks outside that looked like they had complete hazmat suits on, and then you would see people that didn't believe this was happening and were completely unprotected. But I think in general, there was just fear of what was happening, very understandably so.
And also you talked about Dr. Easterling, Assemblymember Reyes talked about too, like the way information was being transmitted. Especially, I say this as a news reporter, this was kind of an uncharted territory. And a lot of the doctors we spoke with said, in the health department said, listen, we've never been in this place before. It's kind of like learning while you're in the middle of, learning how to fly the plane while you're 30,000 feet above the air and going into a mountain range. So in terms of the information, you've tried to tell us some of the things that you've tried to do in terms of getting out accurate information and really building that trust within the community, because that seems to have been a real problem. A lot of people just, first of all, they didn't believe it was real. Then they didn't believe that, people were actually dying from that. Then they didn't believe that they needed to, if a vaccine could help them. Other people had a lot of skepticism. How do you deal with that?
Yes, Lisa, really good question, and you hit the nail on the head. We were certainly building the plane and we were flying it all at the same time. I mean, this was a new coronavirus, and even though there were previous coronavirus, but the way that this virus spread from many continents to continents, and then having to really try to help people understand what their roles could be was really challenging. And so, like you said, really want to acknowledge the role that Assemblymember Reyes had played as a frontline healthcare worker, but also just many essential workers, whether they were cabbies, whether they were at their bodega. A lot of people were getting out information. So the things that we did, we use our existing infrastructure. So the mayor was holding press conferences on a daily basis. We were certainly getting a lot of information out through news media outlets, but then also on our website, which was really important. But which is a really important part of our public health infrastructure, are the many community-based organizations and mutual aid societies that are out there on the ground, really knocking on doors, talking to individuals, including our faith-based organization. So, I don't know how many town halls I did, probably in the neighborhood of 1,000 or more, but really just being out there. But we had so many physicians, so many folks that were out there holding these town halls, because we had to keep our distance, but we still needed to make sure that information was getting out there.
Styles P, in terms of how people have gotten the information, do you trust the information? Because you're very opinionated on a lot of these health issues and stuff. And do you think there was enough emphasis on people really changing their lifestyle too? Because, obesity was one of these factors that made you more at risk.
This is a deep subject because we're speaking about racism and how it affects the community. And I am very opinionated. So I really look at it from my own really honest personal standpoint.
That's what we want.
I feel us brown people, Black people, whatever you want to call it, we have to stop looking for the government and white America to give us a fair shot. We have to stop looking for them to stop being racist. That is not going to happen. You have to work with the people that are not racist and that are willing to work with you, and you have to really look where the country is. If you look at America and look at America's healthcare system, and as the sister was mentioning, all the things we deal with, that is definitely, we deal with it most in the brown and Black community. But if you look at the population of America and what's going on, there's a lot of white people that are misinformed. So the higher ups, the 1%, don't care about the white people that are in the 99%. So how the hell are they going to care about the Black people? So I feel like it's on us to have whatever sources of information you could get and get together and not just argue. I feel like somehow it was a program set up for people to argue. Like if you have a different opinion than I have a different opinion than you. Now we have to dislike each other, argue instead of getting all the information possible, instead of saying, okay, here's why I feel safe, here's why I don't feel safe. And you being able to tell me the same thing, and whether we agree or not, be able to move forward as a society. I think society has programmed us as brown people to keep looking at white people to stop being racist when that's not gonna happen. We keep looking for them to take care of our health when that's not gonna happen. The proof is in the numbers, the proof is in the pudding. So I think it's for all, people of color to say, we have to take care of each other, and whether you're in Congress, Senate, healthcare system, you're an essential worker, you sell juice, you do music, you're a construction worker, you're just a mom, you're a pop. We as a people have to start being informed just about what's happening with our bodies, what's happening with the food that's put out, what's happening with the education on the food that's put out. And then I think we're able to move on.
I want to hop in and add something. I think that kind of to build on what Styles P said, there has been a lot of misinformation and a lot of mistrust. I think there's a fundamental mistrust in government, period.
Period, across the board right now. Yeah.
Across the board, right? And some of it has to do with historical conditions and things that happened. Some of it has to do with general misinformation that's disseminated on public media. But I think that people just can't be mistrusting for the sake of being mistrusting. The reality is that if you look at, for example, the people on the front lines in government in New York City and New York State, a lot of them are young, Black, brown people of color that come from the same neighborhoods. We have lived and experienced the same things. We live in and experience it the same day because I live in the neighborhood that I represent. So all the conditions that my community is facing, I face them too. I'm raising my kids in that community. So when we go up to Albany to pass laws, to advocate, I mean, one of the reasons why we had testing in our communities, why we fought so hard to have the vaccine come to communities of color is because we know that historically we have been excluded from treatment, right? And then when people talk about this Tuskegee experiment, that's not that they were experimenting on us. That was just that they were withholding treatment that could have saved lives. And what we didn't want was that to happen during this pandemic.
We've seen some of these steps that have been done, but in terms of influencing the structure, especially for women too, what do you see can be done to help dismantle that any elements of racism that are in our healthcare delivery system?
Yeah, I think for one is we really have to put resources into the delivery of healthcare for women and in communities of color. For example, if you look in our communities, we don't have birthing centers in the Bronx. There are very few places where women have to choose from to deliver their babies. We want to make sure that they have access to doulas and midwives. And we want to really remove the barriers to a medical education because we want people of color from our communities to be able to afford and be able to get into medical schools and nursing tracks. And, you know, we start from very early on teaching sciences and humanities. So kids become interested, become engaged. And we want to provide resources so they can actually go to medical school and come back to our communities and be the face of healthcare delivery in our communities, because we need people that look like us, that understand our culture, that understand our needs, to be the ones that are delivering our healthcare. And like I said, we need to put resources into these initiatives.
No, and you talk about who's delivering the healthcare in terms of the medical profession. Dr. Easterling, what about in terms of doctors? There's very few Black male doctors out of all of the doctors, underrepresented.
Yeah, absolutely. That is the real sombering fact that we are actually seeing now less Black men, Black and brown men going into medical school than we saw in the 1970s. So, you know, as Assemblyman mentioned, we need to really support a pipeline. We need to be engaging our young folks, certainly at an early age, talking about our elementary school, but then we need to make sure that all the other systems that are impeding our young Black students, young Black and brown students, in getting into these type of fields, that we have to address them. So whether we're talking about the criminal legal system, whether we're talking about housing, we need to make sure that there are systems that are really supporting them, while also making sure that there's a pipeline. And then I would also just mention, you know, as we're talking about representation, I mean, this is the very fact, again, that I don't want to be the only Black male doctor that's standing in my position,
right?
Mentoring, right? Mentorship is really important. And so, you know, the way that Styles has been starting off each segment, we got to ground this in love and compassion, right? We need to reach back. We need to make sure that our kids see us and feel us and make sure that they know that we're real.
Styles, what about in terms of understanding and reaching back? You try to do that with what you do.
Yeah, we try to do that a lot. I think we're on the path with what we're doing now. I think what it's going to take, for my personal opinion, for brown people is exactly like what we have going on right now. We have a Black male doctor, a prominent brown queen, assemblywoman nurse, you know, a guy that's from the streets. We have to be able to unify on all fronts. We have to stop letting finances and classification separate us and understand that we have to combine together as a people. If there's someone you could combine with and push forward the message of, hey, taking care of yourself, get your education right, take care of your body, move forward, because we have a lot of fights at once that we're fighting. So, you know, strength in numbers and a strength in love and positive energy. So I feel like if we have that, it'll make a big change and a big difference and a way to push forward. And we'll break down barriers within the brown community, but we know we could be combined. You don't have to feel intimidated if someone has a different background than you. If you college educated their street or vice versa, you should still understand that we're all pushing together forward to the brown community.
I'm Lisa Evers. Remember, use your mind, it's your best weapon. Let's push for peace, love, and health equity for all.